Hi everyone, my name is Jennifer and I'm an audiologist at Bentley Hearing Services. I work from our Wonderland Road office. Over the next few minutes, I'm going to talk about the vestibular system, how it functions, what happens when it doesn't function properly, and what to expect when you come to have it assessed at our office. What is the vestibular system? The vestibular system is a finely tuned set of sensors located within the right and left inner ear, whose primary function is equilibrium or balance. The sensors are made up of 3 semicircular canals, which are sensitive to changes in head position, and 2 otolith organs, which detect linear acceleration and changes in our body's position with respect to gravity. Besides these internal sensors within the head, there are 2 other systems that provide information from our external world about our position and movement: the visual system and the somatosensory system. Information from all 3 sources is received by the brain and analyzed. The brain then coordinates the correct motor response to maintain our balance. By way of example, if I turn my head to the right, the inner ear and the visual system detect the turn and send this information to the brain. The brain receives this information very quickly, analyzes it, and then coordinates a response from the eyes so that I maintain visual focus and the world doesn't move when my head turns. Likewise, if I trip and stumble forward, the inner ear detects the quick forward movement and sends this information to the brain. The visual and somatosensory systems also send information to the brain about what is happening, and a response is sent to the muscles in my arms, legs, and feet so that I can orient myself, restore balance, and prevent myself from falling. We typically don't spend much time thinking about the important role our vestibular system plays in our daily functioning. That is, until something goes wrong. When the system sends inaccurate information to the brain, we become acutely aware of the vertigo and loss of balance that results. What is vertigo? Vertigo is an illusion of movement, a feeling that you are moving when you are not. It is often described as a sensation of spinning in a circle or falling in a certain direction. It may also be perceived as rocking, swaying, or tilting. It does not refer to lightheadedness, feeling faint, or being disoriented. Vertigo occurs when there is a disturbance or injury somewhere in the vestibular system. In a normally functioning system, when the brain gets equal sensory input from both inner ears, it knows that your head is still and that you are not moving. If the sensory input is greater from one ear, the brain thinks you are turning your head towards that ear. Now let's imagine that the right ear is injured and can no longer provide input. The brain will interpret the greater input coming from the left uninjured ear as a head turn toward the left. You will feel as though you are turning repeatedly toward your left side, even though you are still. This is vertigo. What does vertigo have to do with crystals? People with vertigo symptoms regularly ask about the crystals and how to fix them. They are referring to the calcium carbonate crystals called otoconia, which sit on top of one of the vestibular structures in the inner ear. These crystals have become fairly well known in recent years as they are responsible for the most common cause of peripheral vertigo, BPPV. BPPV, or benign paroxysmal positional vertigo, occurs when crystals come loose and end up trapped and floating within the semicircular canals. When the head turns, they roll around in the semicircular canal, resulting in short bursts of spinning vertigo, lasting typically less than a minute. When the head stops turning, the crystals settle back down again, and the vertigo stops. People often experience these short bursts of vertigo at night when lying back in bed, when rolling over onto one side, or when looking up. BPPV can occur as a result of trauma, infection, or as a result of natural degeneration that occurs as we age. While it can occur at any age, half of people over the age of 70 have had at least one experience of BPPV. Fortunately, BPPV is highly responsive to treatment maneuvers, such as the Epley maneuver. The maneuvers are designed to move the otoconia around the semicircular canal, sending them back to the area where they belong. While there are many do-it-yourself methods available on the internet, treatment maneuvers should be completed under the guidance of someone knowledgeable in order to increase effectiveness and to reduce the likelihood of recurrence. If done correctly, BPPV symptoms are eliminated in 80 to 90% of patients after just one treatment. While misplaced crystals are a common cause of vertigo, they are certainly not the only cause. In fact, vertigo may have absolutely nothing to do with crystals at all. There are a number of other conditions that can cause disturbance or injury to the vestibular system and result in vertigo. Some of these include viral infection of the vestibular nerve or the inner ear, toxicity or trauma to the inner ear, Meniere's disease, or migraine. Each of these conditions will have a different set of symptoms, precursors, and timelines. To accurately diagnose the condition responsible for your symptoms, your physician will need to know exactly what you are feeling and for how long. Describing your symptoms accurately can mean the difference between a successful diagnosis or one that is missed. In addition to obtaining a detailed history of your symptoms, screening or diagnostic testing may be performed to see if your vestibular system responds accurately to changes in head position, movement, and acceleration. At Bentley Hearing Services, we provide an initial vestibular screening, which assesses hearing, balance, your ability to maintain visual focus during head movement, and eye movement in various head and body positions. We use video recording goggles to clearly detect small eye movements and to remove your ability to visually suppress vertigo. If BPPV is thought to be a contributing factor to symptoms, treatment maneuvers can be performed. A report of results is sent to the primary care physician with recommendations for a full diagnostic workup with otolaryngology if warranted. Recommendations may also include referral to neurology or cardiology, although referrals are still made by the primary care physician. Vestibular rehabilitation is not currently provided through our office. I hope you have enjoyed this talk on vestibular function. If you or someone you love is experiencing problems with dizziness or balance, please speak with your doctor or give our office a call at 226-393-5922 to schedule a screening.